Initiatives at the American Academy of Pediatrics. Um, and I work closely with the Boston University team on the CMC Echo and on the larger CMC CoIIN project. And I just want to reiterate what Amy said and thank all of you for your participation in this Echo over the past year. It's been fantastic with a very engaging and important discussion. So thank you. So as Amy mentioned, today we're going to be giving a high-level overview of themes and some of the evaluation data, but we really want to hear from all of you. So we're going to save a lot of time for that at the end. Next slide. I don't have any conflicts of interest. Next slide. As I mentioned, we're going to be providing an overview of outcomes and themes, and then we have some discussion questions at the end for all of you. So to recap some of our program goals, it was to increase clinician knowledge, comfort, and competence regarding care for CMC during the pandemic, and to provide a forum for mentorship and support to clinicians and other healthcare professionals. Our primary audience was pediatric primary care providers, specialty care providers, and interprofessional CMC CoIIN teams, including families. Next slide. So we've been holding our Echo sessions for a little over a year. Due to high demand, we did have 2 cohorts, one interprofessional cohort with CoIIN teams and one with pediatricians and other healthcare professionals. Next slide. So we had a little over 200 healthcare professionals and other professionals who care for CMC participate in our Echo. And those are some of the different examples of the type of professionals that participated. And average attendance was about 20 per session. Next slide. We hosted 28 sessions addressing a variety of topics, and we really relied on our interprofessional faculty to help us determine session topics and on questions and discussions that came up from all of you as participants to determine what to focus on. So you can see a list of several of the topics we covered. This doesn't include everything, and then the expertise of our faculty as well. Next slide. So as I mentioned, we're going to be talking about some high-level themes that we as staff noticed, but we'd really love to hear from all of you to see if there's other themes that you noticed as well throughout the discussions. Next slide. So there were many discussions. I would say almost every Echo, especially when we were talking about case discussions that that focused on addressing the needs of families. What we heard from families is that many of the challenges that they faced before the pandemic and caring for their child with medical complexity were really elevated during the pandemic. So that included respite supports and home care supports for families. And really focusing, a lot of the discussions focused on balancing the needs of families versus the risk of COVID-19 spread. And we heard a lot from families about the unrealistic expectations that they needed to be on 24/7. Next slide. So to continue the focus on family needs, there was quite a bit of focus on shared decision making with families in all of our sessions. And this was to really carefully balance the needs of families versus risk of COVID-19 and all sorts of decisions that had to be made during this pandemic, whether it was return to the doctor's office, return to school in person or virtually. And a lot of our discussions focused on ensuring that families were active participants and partners in the decision-making processes. So a couple sessions that we highlight here on this slide are shared decision-making between schools and families and providers about in-person versus virtual learning and around disaster planning. Next slide. Many of the discussions focused on solutions across disciplines and the roles of each stakeholder within the system of care for children with medical complexity. We really focused in a lot of our discussions on that team-based approach for families and providers during the pandemic, just with all the challenges that providers and families were facing. We talked a lot about the different roles of different professionals, such as health, social workers, community health workers, care coordinators, and others. Next slide. So I think this slide on communication gets a bit back to shared decision making, but we talked a lot about the importance of communication with families and between different types of providers during many of our sessions. This occurred during when we talked about communicating hospital restrictions with families, discussions between healthcare teams, providers, and families and schools around return to school, um, conversations around vaccinations. And then during the palliative care session, we really talked about building that communication toolbox to help providers have sometimes difficult conversations with families and how best to do that. Next slide. Because the ECHO was very interprofessional, there were discussions related to improving the system of care for CMC to address the needs of families. So a couple of examples are listed here on this slide related to unmet mental health care needs and the integration of behavioral health into primary care and developing crisis standards of care in collaboration with families to really reduce discrimination. So now I'm actually going to turn it over to Meg, who's going to provide an overview of our evaluation results from our 6-month assessment.
Thanks, Christina. Before I do, my name is Meg Mo, and I'm the principal investigator for the Children with Medical Complexity CoIIN project at Boston University. And it's been my pleasure and privilege to work for a number of years with our colleagues at the AAP. So I just wanted to say thank you again to Amy and Christina and Shannon and the other members of both the AAP team that we work with, our collaborative partners there, and also the folks who are based in the ECHO program at the AAP. It's been an enormous pleasure to work with you on this particular project. I also want to thank our faculty again and our guest presenters who contributed in amazing ways both to the creation and the conceptualization of the ECHO program and who also served as speakers, as presenters, as moderators, and as participants, discussion participants. I want to give a special shout out, however, I love everyone, but I want to give a special shout out to Judy Palfrey, who, when I was still in proposal writing mode for the CMC CoIIN, told me, you got to include an ECHO, you got to include an ECHO. An ECHO is really going to be helpful to you. It's really important. And I didn't have any experience with an ECHO at that point. I think this, the success of this particular ECHO, the timing nobody would have chosen and the topic nobody would have chosen, but I think this particular ECHO really lent itself to some amazing medical education. And I wanted to tip my hat to Judy and thank her again for her encouragement and her support around the idea. I think today might be a special milestone day for you, Judy. And so your accomplishments and your work over many decades is just, it's too numerous to enumerate today, but we want to thank you very much for all of that. And we hope that you will stay in touch. I see that you've unmuted yourself. Did you want to jump in?
Sure. I mean, it's been such a pleasure to be part of this CoIIN and to learn so much. And I really think this ECHO has been a tremendous asset for everybody. I know I've learned so many things, and so thank you. Thank you very much. This is, in fact, my retirement day. So thank you.
Thanks, Judy. I'm going to go ahead and turn to the slides now. I'm going to try to move through them relatively quickly so that we have as much time as possible for discussion, because what I have to say is less important than what you all have to say. We certainly learned that from the ECHO. This evaluation plan that we have gathered data through a post-session survey. You all should have received links to that after every session. We did a mid-program survey. We've also done a post-program survey in June of this year. And then we're planning focus groups with participants, with faculty, and with other folks in July and August of this year moving forward. So while we're going to present some evaluation data today, it's incomplete. It's only up to the first 6 months of the echo. We're gathering the data and doing the analysis now of the second 6 months, and then we'll look at the whole year. I don't know if it surprises anybody else, but it surprises me when I realize that we've been doing this for a little bit over a year. And it seems in some ways that the time has flown, and so we've still got a lot more work to do, which we will be sharing with you through a variety of different venues. Next slide, please. So this data that I'm about to share with you is from the 6-month assessment. There were 18 participants. We had an 18% response rate. 18% participants responded to our request for feedback. Many of them attended 9 to 12 echo sessions. At that point, about half of them had attended the majority of the echo sessions. Many of them were from academic medical centers. About half, a little over half of them were physicians. Many of them had more than 15 years of experience in their current practice setting. And so on the one hand, I think it's really, really helpful to have this kind of medical education program for early careerists, folks who are in learning mode, and who have a maybe fresh perspective on things. But I think it's equally important to have folks who are experienced, who can really lend their wisdom and their counsel to the discussions that we've had, both on the didactics and also on the case presentations. And a little under half of them were from the CoIIN network. Next slide, please. So we measured around 2 areas, 2 domains, confidence and knowledge. In terms of confidence around the care of children with medical complexity in the context of the public health emergency, these scores show folks who checked either confident or very confident. And we saw some nice growth. The blue is representative before the echo. The red is representative of after the echo at the 6-month point. We saw some nice increases in people's confidence around the care of children with medical complexity in the context of COVID-19. We saw the biggest increases around supporting colleagues in a public health emergency, in finding resources to help keep you informed on COVID-19, and in finding resources to help support family education. Next slide, please. Around knowledge of the care of children with medical complexity in the context of COVID-19, we saw some nice increases as well. Maybe not as dramatic in terms of confidence, but some nice increases as well in terms of knowledge. I think the applying guidelines to support shared decision-making was one, around telehealth was another, identifying and discussing practical strategies to support the mental health needs of kids and families, and also identifying strategies to support the mental health needs of clinicians, staff. Those were some of our most well-attended sessions and the ones that we got a great deal of feedback around, informal feedback around. And having those 2 complementary views and perspectives of mental health needs, I think was somewhat unique in this particular medical education program. Next slide, please. So everybody who responded, and we had 18 respondents, there were 13 of them who responded to this particular set of questions. All of those 13 said that they were satisfied with the training, that their learnings were transferable to non-CMC patients, and that we were appropriately focused on CMC. Finally, the content of the echo was relevant to the patient population. So that was encouraging to us. It made us feel like 6 months in, we were on the right track. We were doing what we were supposed to be doing. And it was very sort of confidence building for us. The other questions that we had 92% rating on these, making me better at my job, contributing to my professional network, and was a valuable use of my time. Next slide, please. So 2 measures here on this particular slide in terms of practice or work change identified. The folks who responded to practice and work change identified, the majority of them said that there were a change in current best practices or procedures in their work, which was very, again, encouraging to us. We had very few people say, I don't plan to make any changes in my professional setting. Changes in my professional clinical setting, changes in a policy or a guideline, sort of, less enthusiasm for that than changes in current best practices, but still helpful. In terms of barriers to applying the echo learning, This is just straight data, and so we can't really infer the causes or the reasons behind the responses that we got. So these are areas in which we plan to follow up in terms of the focus groups to learn more from a qualitative standpoint. The one that really jumped out to us was lack of resources as a barrier to applying the ECHO learning. Now, we don't know if that's administrative resources. We don't know if that's personnel resources. We don't know if that's knowledge resources. We don't know if that's community-based resources. We'll be exploring all of those issues further in the focus groups. Next slide, please. So some of the takeaways from this assessment, next slide, please. To facilitate interprofessional partnership, shared learning on the ground, family-led organizations need evidence-based models and promising practices. I think that, again, the interprofessional nature of cohort number 1, the CoIIN cohort, really shared with us some important learnings around being able to both integrate family leaders and people with lived experience into medical education, and it also told us a lot about what their needs are in that area. To meaningfully address systems issues, care provision for kids with medical complexity requires collaboration across the full spectrum of healthcare, social and community-based service sectors. Now, both of these points are probably not a revelation to folks who have been engaged in this work for a long time, but to be able to have more evidence and more data in this area is always, I think, a contributor. Next slide, please. There's a need to uncover the barriers to clinical implementation that were identified in the 6-month evaluation, which I just spoke about. The interprofessional ECHO model as an option for family-led organizations and system advocacy was an important finding and an important theme. And the ECHO Super Hub should continue to center partnerships as a recommendation that we have, not just a takeaway. It should continue to center partnerships with people with lived experience in their medical education efforts. Next slide, please. So now we're going to open up the lines and we're going to open up things to discussion. We do have some discussion questions that we would like to share with you and get your input and feedback on. But if there are other questions that you all want to ask one another, we highly encourage you to do that. Next slide, please. So out of all the high-level themes noted in this presentation around family needs, about interprofessional approaches, around a systems focus, what resonated most to you and why? What other themes or takeaways did you learn from the COVID-19 and children with medical complexity ECHO? What stood out to you in the 6-month evaluation data? Are there some strategies for overcoming barriers to applying the learnings in your practice or organization that you would like to share with us today so that we can perhaps pick those up as examples in the focus groups? And where do you envision within your spheres of work utilizing this interprofessional ECHO model could be effective? We're not going to go through these questions in a linear way. You know, let's leave them up there. People can respond as they feel they're called to in a more organic and holistic way. And again, I really encourage you all to ask one another questions and the faculty questions, should you have them.